Hi, I'm Dr. Stewart.
And I'm Leah Tyndale, and this is What's Up, Doc.
This mini-series is about mental health, that topic that affects us all, and if it doesn't affect us, it certainly affects somebody close to us.
Yeah, absolutely. And just before we get started, as always, it's really important to note that this is just general advice, and if you do have any specific questions or concerns, you should definitely go and see your local GP. But let's dive in.
Absolutely.
So, Dr. Stewart, mental health, it's a big, broad topic. I suppose the best place to start is the range of diagnoses that are out there, and because, where do you want to start? There's so much that falls under that banner.
There are huge amounts that fall under that banner. I mean, the most common ones that we see are going to be anxiety and depression, and some other conditions that are associated, but there are definitely a long list of mental health disorders out there, and lots of things that affect lots of people, and as I say, either affect the patient themselves or the people around them in significant ways.
Absolutely. So to get started, let's look at depression, because I think that's a really classic one and probably something that a lot of people would like more insight into, especially if you're not sure maybe if you have it or if you're just having a really bad day or week or month.
And this is the challenge, is a lot of people will be dismissive of their own symptoms or of the symptoms of those around them, because they'll say, it's just I've been having a hard time, or it's just a bit of a downtime or whatever. And that's okay. Sometimes that is true. But when it becomes more invasive into our lives, when it starts to infect other areas of our lives, that's when we start to reflect on, could this actually be something more pathological? Could this be something more medical? Could there be an actual medical problem here? So if you have a persistently low mood for a persistent period of time, so usually we say to people, if you look back over the last 2 weeks, have most days been good days? Have most days been bad days? Or is it about 50-50?
Yeah, sure.
And I think unless most days are good days, we're certainly still going down the journey of, could this be a mental health problem rather than just a bad time?
Yeah, okay.
The other things that we look at, things like sleep quality, for example. Poor sleep quality has an impact on your mental health, but it can also be as a consequence of your reduction in your quality of mental health as well. So if we see a reduction in your sleep quality, then that can certainly be something that points us in that direction. And sleep quality reduction doesn't necessarily imply that you're not getting enough sleep. You can be getting tons of sleep, but you wake up feeling like you haven't slept at all.
Right, okay.
Other things we look at, appetite and weight gain or loss. And if that changes, again, that can be an indication of mental health issues. Fatigue is a very common one. People are commonly feeling very tired, and we're all tired lots of the time. We've discussed that previously, and I think it's just part of the overall jigsaw that we're trying to piece together with someone here.
Absolutely.
But people often feel an overwhelming tiredness, and I think that again points us to, there's something else going on here that's not just about poor sleep quality. There's more going on here. And loss of drive and loss of desire to do things that we used to enjoy doing. So commonly people fall away from sports and hobbies and other things.
Right, okay.
They're less socially engaging. All of these features together, and several others, are part of the overall picture that we're trying to paint of someone who actually is suffering with a mental health condition and possibly needs some intervention to help.
And I suppose, is depression often the sort of starting line to whether, okay, you might have depression, or you might then also have another mental health condition? Because there's a lot of obviously crossover between depression, maybe anxiety, and then some more broad conditions.
Yeah, and I see a lot of depression, I see a lot of anxiety, and honestly, I don't think I've ever seen one without at least some element of the other.
Yeah, okay.
But it's usually an 80-20, 90-10 split. Yeah. And what's interesting about that is when you deal with one, the other one becomes much more obvious, because it was perhaps, for example, if you have underlying anxiety but depression's a bigger issue, the depression means that you're less likely to go out and do things, which means you're not provoking the anxiety.
Right.
Whereas when we start to help with your depression, you might become more socially available, and then you start going places and you start interacting with people and you start to feel a bit anxious about it. So it's a little bit ironic that actually this elephant in the room suddenly appears as if from nowhere, when in actual fact it was always there. We just necessarily weren't exposing it.
Yeah, okay. So I suppose that's a good segue into anxiety. What are the kind of broad markers and sort of the thing when we're looking at, okay, that as a mental health issue?
We've all felt anxious. And I think it's a very much a normal human feeling, a normal human emotion. It's when it gets out of control that's the problem. So if you're lying in bed awake, worrying for hours on end, well, maybe that's actually within the realms of normal. Maybe you do have serious financial issues and you really are worried about how you're going to deal with them. But maybe you're worried about something and you don't know specifically what it is, or you're worrying about random things that you know you don't need to worry about, you just worry about them anyway. Those are the issues that when it starts to cross into that space, we start to wonder about, is this something that needs to be investigated and treated a little bit better?
Yeah, okay.
And it feeds into other aspects. So for example, people often present with a headache, and that's commonly because of muscle tension in the shoulders. Everything becomes all nice and tense, and then...
That's a really fascinating point, because I think that's probably something that a lot of people don't know about anxiety. And I suppose then that link that it would come across your whole body.
It can present with physical symptoms.
Yeah, and you might think, oh, this is then just stress, but it, of course, could be very much linked to anxiety.
Absolutely.
Yeah.
And there are other features as well. So for example, people commonly come in and say, oh, I really have difficulty concentrating, or I'm really easily fatigued. And actually, when you probe into that, you discover that they are actually worrying about things. And it's then a case of unpicking that a little bit and saying, okay, is this how you've always been, which may still be pathological, or is this a new thing, in which case we've got something new that we need to deal with as well? So there's lots and lots of things like that. The other things to do with anxiety that really people don't often consider is irritability. So commonly we'll get a patient coming in, and it's been the partner who's encouraged them to come in because they're having lots of fights and they're actually thinking relationship counselling. And when you probe into it, then there is actually some anxiety underlying, and maybe that needs to be focused on first of all, and then if there are consequent issues, we can deal with those.
Yeah, right, okay. So then moving on to other conditions that fall under mental health, we've got ADHD.
Yes.
So what does that kind of, break that down for us just broadly?
So ADHD, and I think probably a generation ago, autism was seen in a similar way, which is that it's seen as being, maybe by some people at least, flavour of the month.
Yeah, okay.
You know, there seemed to be an explosion in diagnoses, and the reason for that is because there is an explosion in diagnoses, but that doesn't mean there's an explosion in cases.
Explain.
Whether we diagnose it or not, people out there have ADHD.
Sure, okay.
We're now just able to diagnose it and treat it.
So you're saying, like, compared to, say, the 90s, which I felt like there was an influx of ADHD sort of diagnosis. It was a bit on trend for a while. But then the way we diagnose for ADHD now is very different, so more people are picking up? Or is it more that people feel comfortable to go...
There's a whole combination.
Okay,
There's lots of factors that play into it. Number one, I guess, the publicity around it, and lots of people being diagnosed and then looking at their friends and going, you're just like me. I wonder if you've got ADHD. And therefore, there is that.
Yes.
There's, again, publicity in terms of media, and even negative publicity where people are saying, is this actually... overdiagnosed, which I don't believe it is. I think there is just a wider acknowledgement of the issue. But that greater availability of knowledge is what prompts that. And also just, in general terms, doctors being more aware of it, more thinking down the lines of, for example, ADHD in about a third of cases coexists with anxiety. So people with severe anxiety could potentially have ADHD. And certainly I've discovered in the past that some patients who have very resistant, treatment-resistant anxiety, in other words, anxiety where when I treat them with the traditional methods, their anxiety either doesn't get better or paradoxically gets worse.
Right.
It makes me now think ADHD, because that's not uncommon to see that happen.
Okay. And is that something that you've noticed because of recent research, or is that something that doctors knew, say, 20, 30 years ago, but it wasn't necessarily that anxiety was recognised and treated as much?
It's becoming more apparent because there are so many more cases of ADHD, and therefore we're identifying the greater frequency with which it coexists with anxiety.
Okay.
And so by definition, it then makes us feed back that loop and think, actually, this anxiety isn't behaving the way I would expect it to. Why is that? And we start to retrace our steps, and that's where I start to think, have I got the underlying diagnosis slightly wrong, or have I missed something important in this, in that it's actually the ADHD that's driving the anxiety? And if we can deal with the ADHD, the anxiety by definition hopefully will then become less of an issue.
So within ADHD, do you have different types, or is it sort of its own banner? Like, how does it work? Like, is there a spectrum or?
So not so much of a spectrum, although you did crossover. So there's the inattentive type, which
Sure.
is the people who struggle with focus, and you know that's a common problem, but in ADHD in particular, it's really quite severe in most cases, where people literally struggle to read a page or a chapter of a book without having to go back and reread and eventually just give up because it's just not working out. So inattention is certainly one of the hallmarks of the inattentive type, and there are a bunch of other features. The other main type, or the other type, is hyperactive or impulsivity. And again, when I was a child, I think kids were just labelled as hyperactive, or mischievous, or naughty, or badly behaved, or whatever. Whereas now we actually understand the underlying condition. And then you get something called mixed type or combined type, which is essentially you've got features of both. And
Right, okay.
depending on where you lie within that, we then move on to a treatment program that's suited to that individual person.
Yeah, right. Okay. So with all these sorts of mental health conditions, whatever it is, there's so many layers, and there's so much, and they often can be crossovers as well. And these are just some of the ones we've talked about at the moment. These are probably the most common, would you say?
Indeed, these are, as we understand it just now, the only types.
Yeah.
But I agree that this is still an evolving field within medicine, and I think we may well understand it better in the future and subdivide further.
Yeah, okay. And now going on more broadly to other mental health conditions,
Yep.
there are ones that I suppose you could say are not as trendy, if you
Sure.
want to, for lack of a better word,
Sure.
but they are very prevalent and probably sometimes more difficult to diagnose because they aren't as common. So we've got things like bipolar, and anything to do with mania as well.
Yeah.
Can you talk me through a bit about bipolar? Because I think there's a lot of misconceptions, especially around it's perceived in the movies, as you've got the manic and just crazy, really, I suppose, for lack of a better word, which is really horrible, and it makes people not seek help.
Indeed.
And then create stigma
Indeed.
around something that doesn't need to have stigma.
Absolutely, and you're quite right about that, and I think there is a perception that we'll encounter later in this series about stigma and how
Yes.
that impacts on people's ability to present. Bipolar, which is more formally known as bipolar affective disorder, is a condition which touches on a few of those things that you mentioned, but its criteria are that you have to have had something called mania, or at the very least something we call hypomania, and also depression generally. There are some subtleties within that, but mania is a very specific medical condition, and it's not often seen by us in the real world, fortunately, because it's actually quite extreme. Hypomania is slightly more commonly seen, and it's just it's a drop down slightly from full-blown mania, but essentially those encompass a situation where someone is the opposite of depressed, if you like. They are effusive, they are very very explosive almost in terms of their personality, but also you tend to see features such as they maybe blow a fortune on credit cards.
Okay.
They'll run up a huge amount of debt, they'll go to the casino and bet the mortgage on black. These types of situations, which are very out of character for somebody who maybe traditionally would have been much more conservative, for example. Depression, of course, we've already touched on, and the low mood aspect of that as well. And sometimes people vary quite dramatically between those two extremes, and it can be an incredibly distressing journey, not only for the patient, but also those around them who
Absolutely.
are directly affected by it, because, for example, financial distress or other issues that it can create. And also, it's difficult to be a person who's caring for or living with someone with a condition where you actually don't know whether you're going to wake up with somebody who's high or low or
Yes.
somewhere in between, and the difficulties that introduces to relationships and to the stressors that families experience every day.
Yeah, wow. Is there other sort of conditions that we should probably touch on that's important just before we close? Because I know, there's obviously things like phobia, schizophrenia that are also under this banner.
Yeah. Schizophrenia is an interesting one. It's a disorder where people are, to at least an extent, detached from reality.
Okay.
And that can be very difficult. There's often hallucinations, whether they are auditory hallucinations or whether they actually see people or things that aren't there. And depending on the severity or the construct of their condition, they might actually appreciate that. They might understand that they don't actually see a squirrel bouncing around on the floor, or they may not understand that. And also sometimes these hallucinations can be either quite aggressive towards the patient, or indeed encourage the patient to be aggressive to others, or they might just be benign and just an observation more than anything. But it can be very distressing to the patient, and even if they do understand that that's something that's not real, it's still a distressing thing to have to live with. So schizophrenia and an associated condition called schizoaffective disorder are both very real and very significant medical conditions that I see patients with on a very regular basis, struggling with. And they're very important to recognise. It's very interesting to me that sometimes patients will come in their late teens, early 20s, and sometimes even later, and say, I've been hearing these voices for a long time, and I just assumed everybody did.
Yeah, right.
And when you actually unpick it, then there is actually some underlying schizophrenia or other psychotic disorder going on. And they just assumed it was normal because it's always been there.
Yes, yeah.
So it's a very distressing condition, but it is something that can be very successfully treated as well.
Oh, well, that's good to know. And we're going to be diving into treatments as well in further episodes. But just to close on sort of this overview, is there any other conditions that you just that's worth mentioning?
There's a lot that we see. You mentioned about phobia earlier, which is that irrational fear of something. There's things like OCD, which people have familiarity with from movies and from, there's a lot of misunderstanding for these conditions, but actually they can all be quite distressing for people. So they're all things that we see on a regular basis. They're all things that we would be able to converse with a patient about, to reassure them, potentially treat them for. And it's all part of the service here at Dr. Stewart's House of Medicine.
That's right, and I think that's a great way to close as well, because there is so much to cover, and hopefully we can help provide some insight and take away some of that stigma, and then hopefully help people to go on their own journey, go and see their own GP, and start getting help and assistance, whatever that looks like. But don't go anywhere, because coming up, our next episode is going to be on diagnosis, and that's going to be so full of tips, isn't it?
I hope so.
So make sure you tune in, because that one's coming up very next. Otherwise, thanks, Dr. Stewart.
Thank you, Leah.